On this Aspirus Medical Monday, Local 3's Brianna McLean is in the studio where she speaks with a doctor about appendicitis and the risks of ignoring its signs and symptoms. Brianna?
Good evening, Rebecca. As you said, this Aspirus Medical Monday is about appendicitis. Joining me via video chat to discuss this topic is Dr. Rachel Lasko, a general surgeon with Aspirus Health. Dr. Lasko, will you first explain what appendicitis is?
So the appendix is a little piece of intestine that comes off of the colon. So the large intestine comes up your right side, goes across the middle of the abdomen, and then down on the left. On the right, the other way. And the appendix is usually about the size of my pinky finger and kind of hangs off the end of what's called the cecum, or the beginning of the intestine. That organ, when it becomes inflamed, is what we call appendicitis. So anytime that organ becomes irritated, becomes inflamed, all in and of itself, that is when you're diagnosed with what's clinically called appendicitis.
What can cause appendicitis?
So anything that causes that piece of intestine to become blocked will lead to infection or inflammation of the appendix. So in kids, we see things like lymph nodes that will get enlarged that live inside of the appendix. That can be caused by viral illness, bacterial illness. So if they get the flu, they may get swelling of that lymph tissue, and then that will cause their appendix to get inflamed and irritated. In adults, we tend to see things a little bit more commonly, like pieces of stool will get stuck inside of the appendix and cause it to get inflamed. Other things like infections and tumors, actually. Sometimes we'll see cancers that will be stuck inside, or that will be growing inside the appendix or in the colon. They cause a blockage that eventually leads the appendix to become inflamed.
What are the signs and symptoms of appendicitis?
First thing that people tend to notice is that they'll have pain in the upper or middle of their abdomen. So right near the belly button is where they tend to have pain. That's because as the appendix initially gets infected, the nerves that go to that area, they're called visceral nerves, they then travel to around the belly button area, and so you'll get pain right there. As time goes on and your appendix inflammation gets worse, that will start to irritate the lining of your abdominal wall. And so you'll get that pain that's down right on the right side, down low. So a patient's pain will move from the belly button area down to the right lower quadrant. And so that is one of the more common signs that we see in patients.
Thank you, Dr. Lasko, for your knowledge on appendicitis. She also mentions if you are experiencing the symptoms of appendicitis, you should visit the nearest emergency room or urgent care clinic. From there, the most common treatment for appendicitis is the removal of the appendix via surgery. In the studio, Brianna McLean, Local 3 News.